Welcome to the Trinity Chiropractic Patient Resource Library, and today we're talking about shoulder mobility and shoulder posture. We see a lot of people come in with shoulder problems. The shoulder joint is the most mobile joint in your body. Any joint that has a lot of mobility has less stability, and that's an important balance to have, both mobility and stability. So the shoulder will often run into problems over time due to its excessive mobility and the postural positions that we get into over time. So for many people, they work at a job where they're either at a keyboard, operating at a workstation, driving a vehicle, or doing something where their shoulders are drawn in and forward, and as a result of that, their head goes forward with it, their neck rounds forward, and their upper back rounds forward as well too, and the arms may be drawn into a pronated position. All of those things over time will lead to degeneration of the joint structure and damage to the tendons, the muscles, the bursa, and the ligaments that surround the joint. So we want to prevent those things and give you some tools today so that you don't end up with a problem in the future, and you can help with many of the things that may be going on today. So if all you do is change your ergonomics, you really won't need a lot of exercises to do for your shoulders because you're preventing a problem from happening in the first place. But I find there are three important stretches that you can do if your posture has been like this for quite some time. Essentially, we're mirror imaging your postural position that you sustain for a long period of time to get the tight muscles to go into their opposite position. One of the first things that we can do is stand again with our back to a wall and elevate our hands over our head with our thumbs facing the wall. When we put our hands into this position and draw our hands straight down, you should be feeling your shoulder blade rotate to bring your arms down to the point where you feel a little bit of tension and activation of the muscles at the lower end of your shoulders towards your spine. They draw your shoulders down and in, and that helps to keep those muscles active because you're being stretched forward from being in a protracted position all day. So that's the first thing that you can do if you're sitting down for a long period of time. The second thing is to take your hand and position it behind your body, doesn't matter which side first, and tilt your head down and away to the opposite side. This way, we're stretching that muscle that's on top of the shoulder that gets too tight for too long, develops a lot of tension and problems through that area as well too. The other stretch that I'd like to do is the door jam stretch, which you're probably familiar with as well, positioning your arm below horizontal and slowly leaning forward to the point of tension. You should feel the tension through the front of your shoulder joint, not pain in the back of your shoulder joint, and holding onto that position. For all of these, you can hold the position for 5 to 20 seconds. You're going to feel a gentle pull on the muscle. It should feel relaxed and in a nice, comfortable position afterwards. If you're sitting at a keyboard all day, you should be doing this about every hour. Make sure you change your position often as well too. There's a lot more with the shoulder that we're going to be talking about in future videos, how to strengthen it properly, and overall posture from the rest of your spine and how that impacts your shoulder. So I hope you enjoy these. We'll see you next time.